Hello.
Good morning. Can you hear me?
I can. Can you hear me as well?
I can.
Excellent, Dr. ZK. Good to see you. And
Yeah, thank
welcome to
sorry.
the conference.
No, a pleasure to be here. Thanks for the invitation.
All right, we will get started momentarily. We've got about 4 minutes until airtime, and we're just waiting on Dr. Eric Griggs to join us. The other speaker is going to be recorded.
Fantastic.
Hey, Eric.
Hey, Christopher, hold on. Sharon's giving me a call.
Okay.
Sharon. Yeah, I just joined. Yep. So go to sessions, click sessions, and you should see your session.
Okay, it just came up. Okay, mine just came up. Okay, all right, thank you.
Okay.
Dr. ZK, how does it sound to you?
No, sounds great. Am I
Yeah.
audible?
Yep, you got a clear picture. You look great, so thank you. By the way, I'm Christopher Holliday. I'm going to be your moderator today,
Wonderful.
and we're both in the government. I work for the CDC
Oh, fantastic.
in diabetes prevention. So,
I think did you speak at the on the Health Equity Council meeting a while back? I don't know.
I did. So yeah, so we've been in some of the same rooms.
Yes, absolutely.
All right. Our technical assistant, also a co-chair for the event, is Eric Meredith. So you see him in now. He's going to help launch videos and make sure that technically we're all in line.
Okay, great.
I think some folks are starting to come in. We've got about 2 minutes.
Okay, great.
Let's grab some water real quick. Hello, everyone. As folks come into the room, we're going to just take a moment to let a few other people come in, and then we'll get started. There he is. All right. Good morning. Dr. Griggs, just want to test the sound. Do you hear me?
Yes. Can you hear me?
Yeah. All right. Well, let's get started. We have the guests of honor. So good morning, everyone. Welcome to the session covering COVID-19 equity and vaccines. I will be your moderator, Dr. Christopher Holliday. I am a member of the 100 Black Men of Chicago and a co-chair of today's event. We are excited today to share the expertise of 3 leading physicians on the front lines of battling the COVID-19 pandemic and making certain that up-to-the-minute evidence is provided in digestible formats and shared with you, the public, to prevent the further spread of the coronavirus. A few quick housekeeping tips. So we will hold a question and answer session at the end of these 3 session talks. But feel free to, at any time, to put any questions in the chat, and I'll do my best to monitor them and tee those up at the end. And also at the end of the session, we will have a 15-minute break and invite everyone to attend our vendor booth session to see all of our wonderful vendors and sponsors. So really quick, I want to do some quick introduction of our speakers. Our first speaker is going to be Dr. Derek J. Robinson. He's the Vice President and Chief Medical Officer for Blue Cross and Blue Shield of Illinois, a division of healthcare of the Healthcare Service Corporation. In his role, Dr. Robinson is responsible for care management operations, clinical leadership, and strategic oversight in providing high-value healthcare to more than 8 million members. Dr. Robinson is also the founding chair of the Health Equity Steering Committee, which was established to develop the health equity strategy across the markets and lines of business for HCSC, the nation's largest non-investor-owned health insurance company. Dr. Robinson is the recipient of many numerous awards and is frequently invited as a speaker to provide perspective and expertise on current issues related to health equity, social determinants of health, implicit bias, and the imperative for physician diversity in the workplace. Dr. Robinson will be followed by Dr. Ngozi Ezike, who is the director of the Illinois Department of Public Health. She is the first Black woman appointed to lead the 143-year-old state agency. Dr. Ezike is a board-certified internist and pediatrician who previously worked for Cook County Health, the hospital and healthcare system addressing the needs for the residents of Cook County for more than 15 years. Dr. Ezike is nationally recognized as an expert in the area of healthcare within the juvenile detention and justice systems, a graduate of Harvard University and the University of California, San Diego School of Medicine. She is certified correctional health professional and diplomat of both the American Board of Internal Medicine and the American Board of Pediatrics. She is also assistant professor of pediatrics at Rush Medical College. Like Dr. Robinson, she's a recipient of many awards and honors, and we all know her as the face of the COVID-19 response in Illinois. She's an advocate for maintaining work-life balance, particularly in challenging times. Dr. Ezike is an avid tennis player and reader and is fluent in Spanish and French. And then finally, we have another renowned physician, Dr. Eric Griggs. Doc Griggs is the health and wellness awareness persona of Eric D. Griggs, MD, a New Orleans-based community medicine doctor and health educator who has dedicated his professional life to raising health and wellness awareness in the communities across the country. In addition to being recently appointed as the assistant professor at the LSU School of Medicine, adjunct professor for the Xavier University College of Pharmacy, and continued role as director of community medicine at Access Health Louisiana. In 2020, the world was affected, of course, by the pandemic. And since then, Doc Griggs has become a local, state, and national figure in explaining the risks, exposure, care, prevention, and treatment against COVID-19. He is the national COVID-19 chair for the 100 Black Men of America and has been adamant and intentional in providing information and opportunities for testing and vaccinations through community town hall meetings, news media outlets, and community health clinics. Let's welcome all 3 of these amazing physicians and look forward to their talks today. We'll start off again with Dr. Robinson.
Dr. Holliday, who did you want to have start?
Thank you, Dr. Holliday, and hello, everyone. It's a pleasure to be on this 100 Black Men panel with some of the most influential physicians in the country. We're assembled here virtually today to drop some knowledge on you that will help improve not only your health, but the health of your family members. So let's get started. Now it's 2021 and we are still in the COVID-19 pandemic, and I just can't have a conversation with you about improving your health without talking about the importance of getting vaccinated. And we've lost more than 740,000 Americans to COVID-19, and we're still not out of the pandemic. And by now, I'm sure you've heard many reasons why you should get vaccinated. And honestly, we could spend all day on this panel trying to dispel the myths that are out there that have held some people back in our communities from getting vaccinated. But let me say this. It's important to note that last year in 2020, Black men lost more than 3 years of life expectancy, which is largely attributed to the COVID-19 pandemic. So getting vaccinated is important for all Americans, and it's especially important for Black men. Getting vaccinated is also a family affair, and so we have to be leaders, gentlemen. So if you have children that are age 5 and older, it's finally time to get them vaccinated against COVID-19 this fall. If you have a spouse or a loved one who's pregnant, now is the time to help her get vaccinated against COVID-19, because we know that pregnant moms who become infected with COVID-19 have a higher risk of premature deliveries, higher risk of severe illness, and a higher risk of death. If you've been vaccinated against COVID-19 and you're eligible for a booster, now's the time to get that booster. I've gotten both my booster and my flu vaccine. Now we know our seniors, they've led the way across the country in getting vaccinated against COVID-19. But you might have a senior in your family or in your community who's not been vaccinated. So I'm going to challenge you to reach out to them, understand what's going on with them, and help them get vaccinated. Because we know that vaccines save lives, and today, a COVID-19 infection is largely a preventable illness. 99% of the people that we see hospitalized with COVID-19 are individuals who have not been vaccinated. So now I have two things that I want to share with you that I think are profound, two really important things. I want to be sure that you're paying attention so you don't miss them. So the first thing is, it's important to see a doctor on a regular basis. That was really profound, all right? Now, the second thing is that the things that happen outside of the doctor's office are even more important in impacting your health and your quality of life than the things that happen when you're at the doctor's office or in your healthcare system. So I didn't say one or two, I said both one and two. So seeing a doctor on a regular basis and the importance of things that happen outside of the healthcare system. Now, as an emergency medicine physician, I can't tell you how many times I've seen a man brought into the ER by his wife, partner, sister, mother, daughter, or some other family member with a medical issue that's been cooking and percolating for quite a while. And I can usually tell what's going on because the person who's brought them in will usually post up by the door, kind of fold their arms, and they want to ensure that when I leave out of the room, the gentleman doesn't get up and leave behind him. And they usually say, we're not leaving here until we figure out what's going on because you don't know how hard it was for me to get in here today. So guess what, guys? There's no glory and no victory in waiting until the last minute to come in and get help with a medical issue. So it's critical that you have regular checkups and regular screenings, especially for conditions like prostate cancer, which we know has a high risk of mortality in the Black community, colorectal cancer, which has new screening recommendations as of this year for begin screening at age 45, and now lung cancer screenings, which are new as well. So you need to see your doctor to ensure that you're on top of these recommended screenings. And most importantly, if something doesn't seem right with your health, reach out to your doctor. Don't let things just percolate for a long period of time. Now, I want to spend just a couple of moments talking about high blood pressure, which is also known as hypertension. And the reason I want to mention it is because it's a silent killer in our community. The most common symptom of high blood pressure is no symptom at all. You feel just fine. But over time, high blood pressure leads to disease in your blood vessels. It makes them hard. It contributes to heart disease, stroke, and kidney disease. And I'm willing to bet that, like me, you've probably noticed new dialysis centers popping up in your communities over the last few years. That's symptomatic of the high level of chronic kidney disease that we see in our communities. And two of the leading causes of kidney failure are uncontrolled hypertension and uncontrolled diabetes. So it's important to see a doctor, one, to know if you have these conditions or if you're at risk for developing them. And then two, the collaboration that you have with your doctor, whether it's regarding taking medications or changes in your diet and behavior away from the doctor's office, is going to be really, really important to improving your health. Now, I said earlier that it's important to see your doctor on a regular basis, and that is true. However, the health care that you receive only contributes to about 20% of your overall state of health. So again, only about 20% of your overall state of health comes from healthcare. The other 80% of the drivers of your healthcare status come from outside of the healthcare system. Now, if you think about it, If you count up the minutes and hours that you spend with a doctor or in the healthcare system in the course of a year, compared to the time you spend away, it makes sense that the time that you spend away probably has a huge impact on your health. So now what I want to do is talk to you about some of those things that occur outside of the healthcare system that impact your state of health. And we're going to start by talking about food. The things that you eat are very important. If you eat foods that are high in fruit and vegetables and whole grains and other unprocessed or minimally processed foods, your health status is going to be dramatically different than individuals who eat a diet that is high in fried foods, high in red meats, high in foods that have high salt content and sugar and that are highly processed. Behavior is important as well. So excessive alcohol use and recreational drug use, these things impair your judgment. They contribute to conflict and violence and unsafe driving and accidents. And as an ER doctor, I can tell you I see the intersection of these things a lot. Choosing to smoke, whether it's cigarettes, cigars, or e-cigarettes, contributes significantly to worse health outcomes. Exercise. We know that sitting all day is known now as the new smoking. So it's important to get up and get exercise, at least 2.5 hours of exercise a week, according to the CDC. That breaks down to about 30 minutes a day. You can break it out into 15 minutes in the morning or 15 minutes in the evening or whatever works for your schedule. But it's important that you prioritize physical activity and get up and move in order to maintain good health. And then location. You've probably heard the phrase that your zip code matters more than your genetic code in predicting your health. And this is because things like the quality of your housing, the quality of the air that you breathe, whether there are toxins in that air or in the water that you drink or the soil that your children play in or the living environment, these things impact your health, both in the near term and in the long term. And in fact, the environment where you live also influences your ability to get outside and exercise and to be able to do so safely. So these things and others like education, income, and discrimination are known as the social determinants of health. And by the way, the social determinants of health are also shaped by the political determinants of health, which is a topic for a different panel at a different time. But I know my time is limited here, so I want to wrap things up and recap what we've talked about here today. So the first is that remember, getting vaccinated against COVID-19 is critical to your health and the health of your family. We need to get that done. Secondly, having a primary care doctor and receiving regular screenings and regular checkups is important to your health as well. And then thirdly, the things that we do away from the doctor's office are going to be even more important and contributing to your overall health. So be mindful of what you eat. Get up and move and exercise. Remove some of those risk factors like alcohol and drug use, and wake up every day thinking about what it is that you can do to improve the health of yourself as well as your family. So take action, take control, and take charge of your health. Dr. Holliday, turn it back over to you.
Thank you, Dr. Robinson. Now we're going to turn it over to Dr. Ezike to tell us a little bit more about COVID-19 in Illinois. Dr. Ezike?
Can you hear me? Thank you so much. Good morning, everyone. Thank you so much for allowing me to be a part of this important Health and Wellness Expo. Thank you, Dr. Holliday, and thank you, Dr. Meredith, for the very important information that you just shared. A lot of the same things I want to cover, so I'm going to try to adjust so it's not completely repetitive, although these things bear repeating. It is so important that we look at what COVID has done to our community. This virus has really been like a plague, and it has disproportionately affected our African American community, and including, of course, our Black men. As we just heard, Black men don't love to go to the doctor. I absolutely have so many similar examples of Black men coming into care at very, very late stages, just trying to hang in there until almost the wheels had fallen off and there was no choice to come in. But we want to have prevention and we want to take care of things early, and the outcomes are much better. And so following that same principle, getting a COVID vaccine is absolutely one of these upstream measures that you can do to help prevent a lot of downstream drama, pain, suffering, and potentially death. So we know the story in Illinois, but just a brief recap. out of all of our Midwest neighbors, we are doing the best in terms of vaccination, but we need to have more. Even though over 7.5 million people in Illinois have been vaccinated, we have to remember that still leaves over 5 million that have not been vaccinated. There's a small sliver there that are not eligible to be vaccinated, and that's only people, fresh out of the womb until age 4. But everybody else, 5 and up, is eligible to be vaccinated. So yes, everybody needs to be vaccinated, but there are some people who need to run and not walk to get that vaccination. And as we think about the holidays, Thanksgiving is just one of the best holidays of the year. Family cannot wait to get together, family that we were born into and family that we've adopted. We all get together at this very special time. And so as we think about that coming up, we still have time to get our booster and to be, fully protected as we get into these indoor settings. So anyone who feels that for sure, individuals over 65, but it's not just individuals over 65. I'm just going to keep it plain. I know the word on the street is that if you're over 65, get a booster. Really, anyone, we're in this state where transmission is high. That makes this a risky environment just to be in Chicagoland, just to be in Illinois. So by definition, if you are at higher risk, you are allowed to get a booster. So we are in a state that has high risk. So we're all eligible to get a booster. So anyone over the age of 18, run, don't walk to get your booster. And if I'm talking about booster, which might be your second or third dose, depending if you started with J&J or, Moderna or Pfizer, if we're talking about second and third doses and you're like, wait, I haven't gotten one, you are way behind, but it is not too late. You need to go now and get a shot. You can get any of the 3. They're all safe, free, and effective at really keeping it real, helping you save your life, right? And we have already seen the disproportionate effect that COVID has taken on Black people. And so we don't need to be complicit in allowing this virus to take more from us than it already has. I have already I'm on dose 3, right? Got my booster about 2 weeks ago, doing fine. So three doses in, and almost, 8 months have passed. And I'm doing fine, and I haven't grown any extra limbs, and I haven't had COVID, which is really the goal. So really, please, I can't stress enough the importance of getting your first shot, finish up your series if you were supposed to get a second, and then if it's time for your booster, please, if it's 6 months after you got your final dose, it's time. And if you got J&J to start with, and I know a lot of people were fans of J&J because it was a single dose, it is time for that booster 2 months after your J&J dose. So again, please run, don't walk. This is how we can protect ourselves, and this is how we can protect those around us. Nothing is 100% effective. There are no guarantees in life, but something that is in the 90s in terms of effectiveness is a really good way to go. And that is our best bet, rather than rolling the dice and taking our chances with COVID. I have received information just in the last week of a 49-year-old firefighter who succumbed to COVID. And he didn't want to take the vaccine. He said, I'm healthy, I work out all the time, I eat right, but we just don't need to take chances with our life. I absolutely want us to continue to exercise, as Dr. Meredith just talked about how important it is, the things we do outside the doctor's office, eating right, drinking less, engaging in healthful practices. All of those things are super important. And if you're already doing that, I applaud you and you're doing the right thing. But that is not to the exclusion of getting vaccines. Again, I know vaccines have taken a blow and have taken a hard hit in this last year, but let's remember why we don't have our little girls and maybe our little boys out there doing double dutch and they've got braces on their legs. It's because they don't have polio, and it wasn't too long ago that you would see people in wheelchairs or have these metal braces on their lower extremities because they had battled polio. I still have friends who are deaf, older friends who are deaf as a result of having battled measles. I have been a physician for over 20 years, and I've never treated a young person with measles because vaccines have taken care of that. I've never seen a kid doing double dutch with braces on because I have never seen polio, and we have almost eradicated polio around the world, but definitely in the United States, the only cases you see very sporadically, the last case was in the 1990s of polio, was when it was imported in from another country that did not have as much vaccination. So let's not do ourselves a disservice and say no to vaccines. Vaccines are our friend. They are life-saving, life-giving, and this COVID vaccine is no different. That is the reason why I think almost 90% of seniors throughout Illinois have gotten at least that first dose of vaccine, and many, and almost 80-something% have been fully vaccinated. Because, you know, we got to listen to our wise, mature members of our community. You know, if Big Mama says it's time to get vaccinated because she has seen all these lives lost, and she has seen people in the nursing home be part of large-scale outbreaks that just took out too many people that aren't with us today, and we have something that can turn that around, let's please do it. So again, all of these vaccines are available and they're free, but I do understand and respect that not everybody is going to heed the call to get vaccinated. So now what? If you're just not sure yet, you're not convinced yet, you're still doing your own research, you're still trying to think about it, what else can you do? And again, I have to give people options because at the end of the day, my goal is to make sure people can be as healthy as possible. And it can't be just a one size fits all, as much as I'd like it to be, just everybody get vaccinated. But if you're not going to get vaccinated, there are some other things that are available. Right now, if you are identified to have COVID, there is something when you catch it, if you catch it early, which means you have to test. You can't know if you have COVID for sure unless you're testing. So please, if you're not going to get vaccinated, make testing your friend. Get tests, free tests are available everywhere. You can schedule it at Walgreens. There are community-based testing sites around the state. Local health departments do testing. Find out where you can get your testing. You can buy a home test if you have the resources and can do that method. You can buy these rapid tests, follow the instructions carefully. But if you identify that you have COVID, there is something called monoclonal antibody. And unfortunately, enough people do not know about this. Monoclonal antibody, this is another treatment option that can be given to people in the early stages of COVID infection, before you're very sick, before you end up in the hospital, before you need oxygen. If this is taken very early after you find out that you're positive, monoclonal antibodies, they can either be administered as 4 subcutaneous injections, just like we do the insulin shots for people who have either type 1 or type 2 diabetes, or a nurse, a healthcare provider can hook you up via an IV and run an infusion of this monoclonal antibody. And that is highly effective of decreasing your chances of not getting COVID, because you've already gotten COVID at this point, but decrease your chances of ending up in the hospital or worse. And again, that's all of our goals, to keep our Black men strong and healthy out of the hospital and worse. And so monoclonal antibody, please remember this. As much as we've been talking about this, I don't think that everybody knows about this. You have to know about it to be able to ask for it. So you're going to reach out to your healthcare provider and say, where can I get this monoclonal antibody? I've just been diagnosed with COVID. And really, for people who are high risk, whether you're older, whether, there's weight issues, whether you have liver issues, kidney issues, HIV, immunocompromised, you take a lot of prednisone for some kind of medical condition, those individuals are even at higher risk. So if you are in that category and maybe you have been exposed to someone with COVID, somebody said, hey man, I just got tested and I found I had COVID. I know we were together, such and such a time, you might want to get tested. If you get that call, that information, and again, thank the friend for letting you know so that you can take action. If you get that call, you don't even have to wait. You know, if you're high risk, you got the call that you were exposed, you can ask for monoclonal antibody, even as a preventive measure, even while you're waiting to get your test. So that's an important piece that maybe a lot of people don't know, but there are options for everyone. So again, I don't want to, you know, stand on a pedestal and say it's vaccine or bust. I think it's the right way to go. They have been proven safe and effective. And if people are saying, well, you know, it came out too quickly, I'm not sure if it's safe. Please remember that people have had this vaccine in their system for over a year now. I mean, we started passing it out in December. The first trial participants got it since July of 2020. So we're really getting to a year and a half with this vaccine. So seriously, there have been, you know, 400 million people around the world who have been vaccinated. So you're really well past, like, I just need to see what happens to other people. There are millions and millions, hundreds of millions of people who have successfully taken this vaccine. And so you can stand on that and feel comfortable. Know that it's been out for almost a year and a half. If it was going to cause severely untoward effects, we would absolutely know by now. So let's please do what we can to protect ourselves. And then for our little ones, kids get shots all the time. You know, they get a shot before they even leave the hospital, and they have shots at the 2-month visit, 4 months visit, 6 months, on and on and on. Before they go into kindergarten, they get that whammy of shots at the 4-year-old, 5-year-old visit. So this is nothing new. We've always been vaccinating our kids to keep them safe from diseases, and COVID vaccine is no different. So we're creating at the state level lots of events around at different schools, at community park districts. If you want to have an event for an organization that you belong to, you can reach out to IDPH and we will bring the vaccines, we will bring the vaccinators, we will bring the stickers and the lollipops for the kids. If you want us to help you organize an event for kids, we can organize an event for adults. We can organize an event that's a one for all where everyone can get vaccinated, but it truly is our way through this pandemic. You know, we want to make sure that these continued disparities in health between Black people and other race ethnicities is shrunk. You know, we have been so intentional with the Illinois Department of Public Health to make sure that Black people are not let off or let out from getting these important things, whether it's making sure that testing sites are in the Black community, whether it's making sure that vaccines are available. We don't want to have any excuse to be part of enlarging these disparities. Every single week, I look at the numbers with the governor, and one page of the report always includes how are Black people doing in relation to other people with regards to this vaccine. And I will tell you, despite me working directly with Black pastors and going to Black churches all across the state to get vaccinated, working with the Omegas, with the Qs and the Alphas and all of our Black frats, working with all of with the NAACP, all of the organizations, we are still seeing a little bit of a gap. It's been narrowing, but we are seeing our largest gap between an 18 to 49-year-old in the Black population compared to others. So there is also another gap, not quite as big, in our youth, 12 to 17, but the biggest gap we have is in young Black people. And I understand that young Black people think, yeah, I heard grandma needs to worry about that, or people in nursing homes, but I'm straight. The truth is, in this last Delta surge, we saw that 44% of people hospitalized associated with this Delta surge were people who were 18 to 49. So young people really got hit by this Delta surge. And of course, those people were largely unvaccinated. There's no debate about whether the vaccines work. Like, I'm not even going to get into that. They work. And the majority of people in the hospital are those who are not vaccinated. But we have seen with time that there's a little bit of waning immunity. And so that's why the boosters are so important. So again, I know I'm singing it like a song, but it's a song I want everybody to chime in and sing the chorus with me, because I want us all to have a healthy, holiday season, Christmas, Kwanzaa, whatever we celebrate, I want us all to be able to ring in the new year and not be taken out prematurely with a disease that is now vaccine preventable. Okay, this is a vaccine preventable death, a vaccine preventable hospitalization, this COVID disease now. So let's do what we need to do to ring in the new year and get on to bigger and better things with our health and with all of our loved ones with us. Thank you.
Thank you, Dr. Ezike, for those amazing words and the wisdom. And we're now going to turn it over to Dr. Eric Griggs, Doc Griggs, to present. Take it away.
Hey, let's go. I'm Dr. Mark Allandari, and I'm an infectious diseases doctor and epidemiologist.
And I'm Doc Griggs, and I'm a community health specialist. On this episode of COVID Noise Filter, we're talking about COVID vaccines and variants.
So you meant to snap us into some three little pigs' tale?
Watch and learn. Imagine your body is like a house, and COVID-19 is trying to break in. Antibodies created from vaccines are like your security system, recognizing the intruder and destroying it. But viruses are smart, and they mutate, putting on new disguises to bypass your security system.
Ooh. So now that I've got your attention, again, thank you for having me, Dr. Ezike. You were spot on. It's good to meet other soldiers in the fight. All gladiators are actually in the arena, so we're ready for questions. Bring it on. I can honestly say that it really is refreshing to actually hear someone that I've never met saying something that I've said over 1,000 times in the last 21 months. I literally I've done over 300 or 300 to 400 TV segments on COVID-19. When this virus hit, it was something that we'd never heard of before, especially us. And we are very strong in our conviction about a lot of things. Now, what it did do is it did expose a lot. We keep hearing these terms called health inequity. We've heard social determinants of health. We heard about monoclonal antibodies for the first time, where there's some antiviral therapy out now that is protective. What's happened is we're at an unprecedented time in the history of our species, our race, and of course, our generation. We've never dealt with a pandemic before, largely because of what Dr. Ezike alluded to earlier. It's the vaccines. I just so happened to miss the cut to get the little dot that some of y'all might have on your arm. I thought it was a cool kid thing to be in like the 4th grade when I was in the 2nd grade because I missed the cut because I wanted one because it was a thing. Well, what it was a vaccine for smallpox and polio. There's all kinds of things that have been eliminated by vaccines. And to be quite honest, our parents and grandparents didn't know what was in it, didn't care what was in it. They just knew that they didn't want to go blind, deaf, or be disabled and unable to walk because they saw the results and heard the results through the years of what could happen were they not protected in some fashion or form. Now, I said all that to say, as a health educator, and as a doctor, my job is not I'm not going to mandate or convince you to one way or the other. I'm going to strongly suggest, and I'm going to promote the fact that it's very safe and that you should get vaccinated. Now, you say you want to do your research, and I'm sure if we combine the number of years that we've been practicing and then this whole thing called medicine and doing real research, you'll get over a couple of centuries worth of experience in learning. I mean, standing up in front of a room of your peers and presenting a paper that you worked on for months, if not years, and being shot down in front of them because your research is no good or you didn't follow a step. That's called a process called peer review. I'm doing this very subtly because you're hearing all these terms. There's a lot of terms. I work directly in media, so there's a lot of terms that I have to deal with in the newsroom that you can't just throw out to people and assume they understand, because what we will do, especially us, we will do the best we can, and then we'll get real creative with it. Well, I don't know about the peer review, but if I stand on the dock, I know, doc, you a doc, I'm going to stand on the dock, you go stand on your peer and keep your shot to yourself is what you're going to hear. We have to define terms, make sure we're all understanding the language. That was the cartoon you saw was the second in a series of, there are 9 now on various topics, from clinical trials to HIV to hepatitis C, but it all started with COVID-19 in an effort to make sure that everyone understood exactly what was going on. As a child, again, I'll date myself back to when I had hair. I watched Bugs Bunny, Heckle and Jekyll, the Smurfs, all the Looney Tunes, you name it. But it's funny. The cartoons captivated us as kids, but the messages were to the adults. And the same holds true with this pandemic. We're all afraid. In the human body, when you're in stressful times, we operate to fight or fly. We've heard of fight or flight. So there's basically 2 hormones that we're operating on. Cortisol, and that's the deer in headlights, where if you're sitting in a room and a teacher calls on you and says, "What's your name?" You're like, you don't know whether you want to run or punch somebody in the face or do both and get out of there. That's cortisol. Cortisol also works to disrupt your sleep schedule. It works to raise your blood sugar so you can have energy to do what you need to do. And epinephrine. Epinephrine raises our blood pressure. We have been living in a constant soup of stress, of cortisol and epinephrine. Now, I don't know about you, but I've been guilty of snapping on those close to me. And, oh, you going to pop off like that, Doc? I'm sorry. My bad. I was a little wired up because someone on the street approached me and wanted to argue about whether or not they take a shot or a vaccine. And to be quite honest, I care about you, but I don't care what you do. But if you're not going to take the shot, stay away from me. Practice your social distancing. Wear your mask. If you want to say that you want to do, if you say you want to do research, well, what I love to do is, and it was in one panel I was doing for formerly incarcerated women, where they sat and they listened, and finally one young lady just fessed up. Like, "Doc, you can say what you want. We're not going to ask any questions because the moment we tell people we're unvaccinated, people just jump on us and no one listens to the questions." And she said, "I have children." This was back in the summer. And this is before the children's vaccines were out, early summer. And she goes, I'm like, it doesn't make me less of a mother to be concerned, but before I consider anything for my child, I need to know my questions answered for me. So I say that to say, those of us that are on the same page, when you're engaging with people that are still waiting, like Dr. Ezike, if you still want to do your research, be patient. And it's mutual respect, right? There's no dumb question. This is something that if prior to not 2019 or 2020, any doctor told you, I don't care if they're infectious disease, public health or what, told you they were a COVID-19 expert, they lied. None of us knew what this was. We had no idea. You had infectious disease specialists. We knew about the class of coronaviruses. We knew about, actually, in case you didn't know, that SARS virus, that's actually SARS-CoV-1, severe acute respiratory distress syndrome. The virus that causes severe acute respiratory distress syndrome 1 is the cousin, as they say, because I'm from North Carolina, live in New Orleans, the first cousin, if not the older brother of SARS-CoV-2. And that's how we got to COVID-19. And again, don't overanalyze. Again, we're finding all this stuff out now. So when COVID-19, it was this time around 2 years ago, almost 2 years ago, that I was in the news station and they said, we're just going to call it COVID. And everyone's like, whoa, COVID. They thought it was this big scientific name. It's not. CO, corona, VI, virus, D, disease, 2019. That's it. COVID-19. And I'm saying that so you can make it understandable and you can digestible and you can really understand the information that's going on around you. There are a lot of myths and disinformation out there. Now, everyone's acting like it's new. And sadly, in our community, it's existed since the very beginning. If you can remember, if you frequented the barbershops, of which I still do every now and then to get my goatee. Don't hate, don't judge, no judgy. You would hear the theories back in the early spring of 2020 that Black people don't get COVID. Look at Africa. I don't know nobody in my family with Africa. And then a month later, 3 weeks, a month later, the governor of Louisiana was the first governor to announce that 7 out of 10 bodies that showed up at the morgue that had passed away from COVID-19 looked like us on this panel. They were African American. Mis and disinformation kills. I can't tell you, and I'm sure Dr. Robinson, if he were here, Dr. Ezike, Dr. Holliday, all of us can tell you that we've heard it. Oh, there's nothing that we haven't heard apple cider vinegar. I had to stop people from putting blow dries up their nose. I want y'all to really think about that. These are intelligent people, business owners, people with degrees, putting a blow dryer up their nose, thinking they're going to burn it out and having to go to the ER for second and third degree burns. So people want to inject bleach. All of it isn't true. So know your sources. Some of the best sources that you have are the sources that as Black men, we don't like to deal with. And it's kind of not our fault in a sense, in that we never had that, as opposed to our female counterparts, the young ladies. We don't have an exchange with a doctor that's not comfortable after starting as a kid. You know, when a young lady turns into a woman, they go for their wellness visits and they go for their annual checkups, and it's uncomfortable, but it's a relationship that's fostered over years. As a little boy, the only time I went to a doctor was when I was sick and I couldn't go to school, when I broke something, or after I fell out of a tree. It was always traumatic. So the moment, and then college, if you go to college and you play sports, you have to go, and they're picking and poking and prodding. So the moment you graduate from college, you tell yourself, as soon as I get older, I ain't never doing this again. Then your athleticism tends to fade and your hair goes with it. I'm not sensitive about my hair. I'm looking at myself and the light shining on my head. Y'all see it, so I need to acknowledge it. As you get older, hit about the age 30, your testosterone levels start to drop. The genetics in your family start to combine with your epigenetics, which is the outside factors, those social determinants of health that Dr. Robinson talked about. And all of a sudden, your doctor says your blood pressure is a little high. What's a little high? And then they tell you, because the time spent with the doctor has been reduced to 12 minutes or less, they tell you, you can either try to modify it with your diet or I can give you a pill. So every dude I know, I'm going to take care of it with my diet. And they start eating a bunch of salads on top of the cheeseburgers and on top of everything else. I'm just eating these salads and my blood pressure is going to go down. They're eating at night the ice cream, the tub of ice cream, and they get bigger. By the time they reach ages 40 and now 45, the real factors in the genetic factors in their family come out. Their levels of activity have gone down. They've succeeded in their profession, but as a consequence, they work less. There's less physical activity, which all creates inflammation in the body, makes you more susceptible not only to COVID-19, but all the chronic diseases. My whole point is, by the time we realize and take our health seriously, a lot of times, like Dr. Ezike, Dr. Robinson has said, it's too late to avoid a pill. It's never too late, but it's too late to avoid a pill or some type of intervention. The same thing is here with COVID-19. I can go on and on about the stories that I personally know, people that have passed away, people that have been in the hospital, the ICU, that are wishing, by the time they're in the ICU about to be intubated, they're asking for the vaccine, and it's too late. The only thing left now is the monoclonal antibodies, the remdesivir, and those approved therapies. Now, I cannot believe we're still talking about ivermectin. Ivermectin is safe in humans for certain conditions, and it's won Nobel Prizes for certain conditions, but it does not work for COVID-19. The FDA has come out and said that explicitly. The World Health Organization said it's explicitly not safe for humans. We're doing everything we can, but what's available to us. And again, it's part of the fact that we've never dealt with anything of this magnitude in our lifetime. We're at the very beginning, which is a good thing because a lot of good things have happened. We're able to have this conference virtually, which is so dope. If anyone's traveled recently, this is saving us a lot of headache. But the point is, I really want you to listen to one another, understand everything that we're emphasizing about getting the shots. If you say vaccination, it's the same thing as a shot. We can go over the details of the Pfizer, Moderna, the J&J. I encourage everyone to go ahead and get their boosters. We're going into the winter season, and we're trying to avoid not just the Delta surge, but a typical winter surge. Right now, the flu numbers that I've seen are relatively low, and I can only hope and pray they stay that way as things get closer. People go inside. There's poor ventilation. We know that kids, as much as we love them, they share their bugs and their snot, and you name it, they share it with everyone else, with all of us. So I encourage you all to get vaccinated. Ask the hard questions because we can deal with the hard answers. Thank you.
Thank you, Dr. Griggs, and thank you again, Dr. ZK and Dr. Robinson. We are actually at time, but we're going to take a point of personal privilege and at least entertain one question that's come in. And then we're going to encourage everyone to move into the expo, which to your left of your screen, you'll see now, and click that, and that'll take you to all of our vendors and our vendor booths. But a question around breakthrough cases. What does breakthrough mean? And why does having other chronic conditions put you at higher risk for COVID-19 complications? So I can ask both of you, and we'll start with you, Dr. Ezike, and then Dr. Griggs can follow on.
I was going to throw it to her.
Great. I'll start. I'll turn it over to you, Dr. Griggs. And I want to apologize. I think I've been calling Dr. Robinson, Dr. Meredith, because I'm seeing it on here. So apologies for that. So what is a breakthrough? So we are calling a breakthrough case is someone who develops COVID after being vaccinated. We're calling a breakthrough hospitalization someone who ends up in the hospital after being vaccinated. Now, the thing is, you say, oh, I told you. Why are people still getting infected if they got vaccinated? Why? So it doesn't even work. Well, as with everything in life, nothing is 100%. And so even at the very beginning, when these vaccines first came out, we said that, they were in the 90s, 95% effective. And so when you think about what 95% effectiveness is, that means that up to 5% initially. And let's remember that those vaccines were initially made against the first, coronavirus. And we all know that the virus has mutated and evolved. So really, as we call the disease COVID-19, that's really not even accurate, as Dr. Griggs was explaining how they came to name, because we've had COVID-20, now we've had COVID-21, but fortunately, the vaccines still protect even against these subsequent iterations. And so, yes, we have seen that we've had cases come through and hospitalizations, but it's the exception and not the rule. And we are seeing that with the passage of time, just like when you have a pain and you have to take pain medicine, it's not that you take that pain medicine once and you're covered for the rest of your life and never have pain again. You have to take more pain medicine as that medicine starts to wane or wear off. And so we're in that situation where the vaccine is starting to have some decreasing effectiveness, not completely, but decreasing, and it's allowing there to be more cases and slightly more hospitalization. And so that's where the boosters come in, that you can, boosterize, as I like to say, and get yourself kind of back up to that optimum level of protection to prevent those additional breakthrough cases and hospitalizations.
Excellent. Thank you. Dr. Griggs, anything to add?
No, what she said, she was spot on. That was excellent. That was absolutely excellent.
Excellent.
I
Well,
just encourage everyone to go ahead and get vaccinated. What the vaccine will do will shorten the course of your disease and decrease the likelihood that you will be hospitalized or die, and that's what we all want.
Well, thank you both. Thank all three of you for your amazing remarks today. Very poignant, very timely, and I know that our audience learned a great deal. And the fortunate thing is we'll have this to play for future audiences, and we'll post it to our website. So now we're going to encourage folks to please go out, get your vaccination if you are in an eligible group, and also please do get your flu shot as well. Stay healthy and stay well. And we're going to ask everyone now to go to the expo booth and take a break. And then we'll see you at 10:45 for the next session. Take care. Thank you, everyone.
Thanks so much.
Thank you.
All right. Bye-bye.
Pleasure meeting you all.